Thank you to our witnesses for being here today to talk about your personal experiences and helping us talk through this issue. My colleagues have raised some really important issues and questions about how do we improve and expand care at home for Americans, and especially in rural and underserved communities. And I want to focus on how telehealth fits into this effort. All of us here are familiar with the importance of broad access to telehealth services. The COVID-19 pandemic, if there was any silver linings out of that, was it underscored how important these services were. Some of you here may have taken advantage of telehealth during the pandemic and discovered just how convenient it is, and not only in a time of crisis. In Kansas especially, telehealth bridges the gap between those who live in rural areas and who may not have easy access to certain specialties. Allowing for greater accessibility to telehealth gives Americans living in rural areas increased access to quality and specialty health care. While telehealth is invaluable in rural areas, it benefits all Americans. Seniors and vulnerable populations benefit from the ability to meet with their doctor from the comfort of their own home. Busy parents and professionals will be glad to conveniently meet with their provider via telehealth, recouping precious hours that would have been spent commuting or in an office waiting room. In fact, nearly 1 in 4 adults report having utilized telehealth in the past month. Now that this technology has been available for some time, we have sufficient data to show how effective and beneficial telehealth can be. 91% of the patients utilizing telehealth report having a favorable experience, and 78% are likely to complete a medical appointment via telehealth again in the future. There's a long way to go to ensure Kansans and all Americans have consistent, reliable access to telehealth services. To cite just one challenge, at the end of this year, the expanded Medicare telehealth flexibility waivers will expire, restricting telehealth access for large segments of the population. Dr. Starr, I think many of us would agree that the acceptance and growth of telehealth has made a significant impact on our constituents' access to care, especially in rural areas. I have long been a supporter of telehealth and view it as a wonderful tool. However, in my district, we've been experiencing significant provider shortages, not just for primary care, but specialty care as well. What suggestions do you have that maybe we can continue to expand and see telehealth as a tool, but not necessarily as a final solution to actual providers in rural areas?
Yeah, thanks for the question. One of the issues we run into is the licensing and credentialing piece for telehealth providers, particularly across states. There are opportunities, to expand your pool of options if we could more easily be credentialed and licensed across states to see patients. And currently that is a very expensive and time-consuming process that limits things greatly.
Thank you. And while we've previously focused on the need for flexibility for patients, I believe that we should also focus on ensuring that providers view telehealth as a valuable tool. And as mentioned before, part of that conversation should be viewed about proper reimbursements and what they should be for telehealth services. Dr. Marotta, from your experience after initial startup and for material costs for technologies, what are other factors to be considered when looking at reimbursement rates? And I wanted to follow up a little bit on Dr. Ferguson's comments and pick your brain a little bit more.
Yeah, I think Dr. Ferguson and you both raise a really important issue, which is the regulatory burden. And just to put a point on this is that if you do a surgery, it makes a lot of sense, you submit the bill. But when you're doing an individual, a text message on a phone or a quick phone call or something on a portal, it doesn't make sense to have an individual bill for each encounter. So the real growth of telehealth and the really promising technologies we've discussed today also have brought to a head of how do we pay for this in a different way? And I think one of the things I'm excited about is, and we should just continue to expand upon, is trying to pay for these kinds of services with, say, for remote patient monitoring as a monthly bundled payment. So you get, here's a certain amount of money, you figure out what's the most appropriate way to care for patients. We're seeing this for opioid use disorder, where we pay a month, a payment per month. And I think the reason I'm excited about those is that, one, it can support the technology, decrease the regulatory burden on individual clinicians for submitting all these little bills, and also allow clinicians and patients to figure out what makes sense for them under this circumstance, as opposed to having some payment rule for that. So I think this telehealth growth and payment reform sort of go hand in hand.
Yeah, that's good, because we talk a lot about the fee-for-service and the restrictions that are on that, and paying to not be sick as opposed to paying to be healthy and stay in that way. So thank you all for your time and effort in talking through this. So.